let me discuss first the branches of your autonomic nervous system. So we have sympathetic nervous system and as well as your parasympathetic. So basically it's your ANS. ANS has two branches, sympa and your parasympa. When you say sympathetic nervous system, this is fight or flight, and this is rest and repair. In other words, if you are resting, your body is repairing as well. You're in a resting phase, you don't do anything, the responsible nervous system is your parasympathetic. Now, the other way around, which is the opposite, if you're like having like a stress and then you're fighting, it's either you fight or you flight, the same thing. You've been activated, everything is activated. It means to say that's your sympathetic nervous system. In other words, that's your fight or flight. The dominant nervous system is the sympathetic nervous system. And as I've said earlier, it's automatic from its main branch, the autonomic nervous system. It's automatic. You cannot control it, so you just have to deal with it. So the nerves involved here, coming from the brain into your spinal cord and into your peripheral nervous system. Remember, this is a branch of your peripheral nervous system. So ANS tayo. So this is one branch of your peripheral nervous system. These are peripheral nerves basically. And we call it as your dopaminergic and adrenergic nerve. You know why? Because because this is where your noradrenaline, or also known as norepinephrine, norepi, the neurotransmitters involved, ito siya, the norepinephrine. The norepinephrine or noradrenaline, in UK, they call it adrenaline, or also known as norepinephrine. The neurotransmitters involved are this, and at the same time, acetylcholine, because acetylcholine is also dominant. It's not only pertaining to parasympathetic. So acetylcholine and your norepinephrine, these are the neurotransmitters involved here. The receptors involved, where do they bind? So receptors involved, this norepinephrine and acetylcholine binds to your alpha receptors, alpha 2, beta 1, and beta 2. What about your alpha 1? Your alpha 1, these are found in your smooth muscles. The mnemonic is letter S, that's the alpha sign. It's found in your smooth muscles, in your organs, and as well as in your glands. For example, in the smooth muscles of your blood vessels, organs, for example, in your bladder, okay, in your genitourinary system. In your glands, for example, adrenal glands. That is where your adrenaline and your norepinephrine, and as well as your epinephrine, are secreted. So these are found in your smooth muscles, organs, and glands. That's your alpha 1. So what about alpha 2? Alpha 2 natin is the inhibitory one. Letter ito, alpha. It looks like an S. That's why it's smooth muscles. So alpha 2, inhibitory. Also is in your smooth muscles. Smooth muscles as well. However, the function is inhibitory. In other words, this is the stubborn one. If you have the function of your alpha 1 as to cause vasoconstriction, alpha 2 causes vasodilation. So it's the opposite actually. So beta 1, you can find it in your what? You only have one heart. It means to say it can be found in your heart. That's your beta 1. What about your beta 2? Your beta 2 is found in your, we have two lungs, the left and the right, hold them tight. So these are found in your lungs. So what about the functions? What about the effects? So in your smooth muscles, what's the effect? Increase in your blood pressure. We will talk about that after this one. Increased blood pressure in your alpha 1. In here, alpha 2 is the inhibitory. In other words, it causes hypotension, it's elevating your blood pressure. It's the inhibitory. What about your beta 1? It increases your heart rate and it increases also your blood pressure. Beta 1, you only have one heart. That is where your beta 1 is found. If you block your beta 1, for example, it can cause decreased heart rate, decrease in blood pressure. How about your beta 2? Increase in your respiration, increase in your RR. Let's just say hyperventilation. That's your beta 2. Hyperventilation, or should I say dilation, bronchodilation. It causes dilation of your bronchial muscles, causes you to have dilation. So relaxation of your bronchial muscles. Let's move on to your parasympathetic nervous system, rest and repair. So the nerves involved here, the name of the nerve is cholinergic nerve, because the dominant neurotransmitter is acetylcholine. We also have acetylcholine here, but the dominant in your sympathetic is your norepinephrine or noradrenaline. That's why it's called adrenergic nerves. On the other hand, when you say acetylcholine, the dominant one is your acetylcholine. So it means to say the nerves involved here are what we call as your cholinergic nerve. And your acetylcholine will bind to your receptors. And what we call these receptors, we call it M1, M2, and M3. Collectively known as your muscarinic receptors. Your M1 is found in your stomach, letter T. There you go. Looks like number 1. That's stomach. M2, saan nakikita yon? In your heart. Number 2 looks like heart. If you put something on the other side, like, that's M2. So heart yan. M3, how about M3? Smooth muscles. It looks like letter S. Ang number 3. So that's how I remember it. So smooth muscles. These are your muscarinic receptors, namely what? M1, M2, M3. If you look at this one, collectively, if you have muscarinic here, we collectively call it as your adrenergic receptors. So these are adrenergic receptors. Alpha 1, alpha 2, beta 1, beta 2. Alpha 1 adrenergic, alpha 2 adrenergic, beta 1 adrenergic, beta 2 adrenergic. On the other hand, M1 muscarinic, M2 muscarinic, M3 muscarinic. You can find your M1 in your stomach. The effect is digestion, emesis. And these are just one effects. Here, if you have increased heart rate, this is the counter mechanism, or the opposite, which is decreased heart rate and decrease in your blood pressure. How about smooth muscles? Constriction, decreased RR, hypoventilation. These are the most important ones. Bronchoconstriction. In your stomach, it causes digestion, emesis, and many other things. Increase in your hydrochloric acid, for instance. Decreased heart rate in your M2. You can find it in your heart, these receptors, the muscarinic receptors. It decreases your heart rate and decreases blood pressure. Smooth muscles and all the rest of the organs as well. Decreased respiratory rate, specifically in your lungs. Kasi your bronchial airway is made up of smooth muscles. That's why smooth muscles here. M3 yan. So decreased RR, hypoventilation, and bronchoconstriction, and many other effects. I'm just telling you what needs to be organized and what needs to be placed. Where is this going? Where is this nerve located? Something like that. Again, sympathetic, the nerves involved, dopaminergic and adrenergic. Neurotransmitters involved, acetylcholine. In this, marami rin siya. It's also dominant. Norepinephrine is the most dominant, of course, especially in the target cells. Target cells, for example, in your heart, in your lungs, etc., etc. And the receptors involved where your acetylcholine neurotransmitters are going to bind is your alpha 1, alpha 2, beta 1, and beta 2. We call it as your adrenergic receptors. On the other hand, we call it parasympathetic nervous system, the opposite, rest and repair. The nerves involved here, the name of the nerve, we call it cholinergic nerve. The transmitter, the neurotransmitters that are flowing through here, these are acetylcholine, all the way from the nerves into the target cell. Receptors involved, muscarinic, M1, M2, M3, accordingly. This is your brain, right here. Then this is your spinal cord right here. This is your brain, spinal cord, it's right here. So central nervous system, of course, that's your brain and your spinal cord. Of course, your parasympathetic nervous system, we were talking about ANS here. That's your autonomic nervous system. Once it leaves the spinal cord, that's already your peripheral nervous system. And one branch is your autonomic nervous system, in which I'm going to specify. Since we're talking about neurons, nerves, and everything, so I'm gonna draw here. Here is your T1, T2, T3, T4, thoracic vertebrae or spinal cord. T4, T5, T6, T7. How many thoracic spine that we have? 7, T8, T9, and up to T12. T9, T10, T11, T12. We also have L1 and your L2. I think that terminates your L2. So from T1 up to your L2, this is where your nerves travel. Now, I'm going to talk about first your sympathetic nervous system. I'm going to write here sympathetic nervous system. Ayan, sympathetic nervous system, the SNS. I'm going to write the organ, I'm going to draw the organ, and then the effects. And then later on, we're going to discuss the effects of your parasympathetic nervous system. So from T1 up to L2, sa medicine, sometimes they don't call it a sympathetic nervous system. Sometimes they call it as thoracolumbar system. Why? Because the nerves are coming from your T1 up to L, thora, and your up to lumbar 2. So how many lumbar that you have? Up to L5 yan siya, di ba? So that's why they call it as thoracolumbar system, because the nerves are coming out from this system, from this particular portions or areas. So in here, if you notice, there's what we call as paravertebral ganglion. When you say para, means behind or beside. So beside there is your paravertebral region. So the nerves are going to travel here as well, pass through this paravertebral region. Parasympathetic doesn't travel through your paravertebral. It goes directly to the target organ. So in your brain and then into your spinal cord, in your T1, there you go. T1 goes right here, and then there's synapses. Ayan, there are 4 nerves involved here. And this is another neuron or another nerves. And then it also travels here. There's another cell body here. And this cell body here goes to your what? Goes into your, looks like a lip. There's the eye. At the same time, it also branches to your salivary glands. So in your eyes and your salivary. So what's the effect in your sympathetic nervous system? The effect in your sympathetic nervous system is less lacrimation, or should I say no lacrimation, and no salivation. In other words, it inhibits lacrimation and it inhibits salivation as well. So that's in your eyes and your salivary glands. Here, these are what we call as your neurotransmitters. And between these neurons right here, from one nerve to another nerve, they will release, neurotransmitters. Neurotransmitters involved here are acetylcholine. Acetylcholine here, in the target organ, right here, norepinephrine. In here is your acetylcholine, the involved neurotransmitters in there, in that particular area. The same thing here, acetylcholine. In your eyes, what's the effect? Let's just go with the opposite later, okay? In your sympathetic nervous system, the effect is no lacrimation and no salivation because that's more onto your parasympathetic. That's the effect in your eyes. So it's more on inhibitory here. When you say inhibitory, it inhibits, or it's the contra for your parasympathetic. In here, will travel here, here. It goes together, and then there are two branches here. This is your heart, and this is your lungs. In other words, respiratory. So the effect in your heart is increase in your heart rate, increase in your blood pressure. In other words, vasoconstriction. In your lungs, what's the effect? It's increase in your RR and bronchodilation in your lungs. So relaxation or spasm, it's relaxation. Relaxation of your bronchial muscles. So that causes you to have dilation and hyperventilation. Okay, that's in your lungs. So what are the neurotransmitters involved here? Acetylcholine, and in here, norepinephrine, and what particular receptors? Beta 1 and beta 2. In your eyes, these are alpha 1 and alpha 1. These are both alpha 1 because alpha 2 is inhibitory. But anyway, these are just examples. So on the other hand, so T5 here, 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 1, 2, 3, 4, another one. They will connect to another. The involved neurotransmitters here are the same thing, acetylcholine. They will connect to your GI organs. Okay, to your GI organs, there's a synapse here. Merong synapse dito. Another acetylcholine here. Release, acetylcholine. And then back to your nerves. Another nerves here. Another nerve. It goes into your GI system, to your stomach, to your pancreas. This is more onto your GI organs right here. Into your liver. And one branch here, not from the synapse, directly from this T5 up to T9 is your adrenal glands. What are the neurotransmitters here on the target organ? Norepinephrine, where they will bind to the adrenergic receptors. So what's the effect in your stomach, in your pancreas, and your adrenal gland? The effect in your stomach is low digestion or less digestion. You could also have less hydrochloric acid. You could also have constipation. In other words, less activity of your GI system. So what about in your pancreas? In your pancreas, less in your pancreatic enzymes. So in general, you don't digest your proteins, fats, and your lipids. Less digestion in general, just like in your stomach. Of course, they work together. The pancreas releases enzymes, pancreatic enzymes, to digest your protein, fats, and your carbohydrates. So less digestion tayo when you say like pancreas. In your liver, it's something else. It's excitatory in nature. When you say excitatory in nature, it's activated. So you will have to increase your glucose. How do you increase your glucose? Itong mga neurotransmitters na to, it will send information to your liver to break down your glycogen. When you say gen, glycogen, pepsinogen, those kinds of gen, those are complex form. You need to break it down by a certain enzyme. You need to catalyze it. When you break down the glycogen, it will form glucose. And it's readily available for the cell. So increase in your glucose. So that's in your liver. What about your adrenal glands? This is very important, adrenal glands. It will stimulate the production of your norepinephrine and epinephrine. Your norepinephrine in your adrenal medulla, these are produced in your adrenal medulla, it will be stimulated. In fact, you already have your norepinephrine produced in your sympathetic nervous system, back in these nerves illustrated. At the same time, in your adrenal glands, it enhances another production of your norepinephrine. So it will amplify everything. That's how important your adrenal glands are. So that's your adrenal glands. Norepinephrine and epinephrine. What else? Siyempre, adrenal medulla lang yan siya, di ba? We still have another portion which is adrenal cortex. In your adrenal cortex, it increases the production of your cortisol. Your cortisol is also known as glucocorticoids. In other words, it can increase your glucose. Increase in your cortisol and glucose. What else? It will also increase your retention of your sodium and water. This is your mineralocorticoids. It retains sodium and it retains also your water. Where sodium goes, water goes. So this will cause also increase in your blood pressure because it increases the blood volume. Again, I cannot trace now your RAS mechanism, but in other words, it will stimulate the RAS mechanism, also known as renin, angiotensin, aldosterone system. So the bottom line or the main goal or the outcome of that trust mechanism is to increase your blood pressure by increasing your blood volume. How? It will retain your sodium and water, and at the same time, it causes vasoconstriction, specifically your angiotensin. But anyway, again, as I've said, it will increase your blood pressure. See, you're stimulating your heart to increase your heart rate and your blood pressure. You're also stimulating your adrenal gland to stimulate your RAS mechanism, and so as to increase your blood pressure. So everything is present, everything is elevated in your sympathetic nervous system. That's because of your adrenal gland and many other organs involved here. So let's see another two here, and then it goes to your another synapses here, norepinephrine, and that would be your colon. So stomach, that includes your small intestines already. Should I say small intestines here? Colon, large intestines in your colon. So basically in your colon, what's the effect? Constipation in your colon. So let's basically no digestion in your colon, and it also branch here. There you go, synapse there. So these nerves, these are just basically sympathetic nerves. If you want, I can say splanchnic nerve, for instance, mesenteric nerves, daming nerves na involved in your sympathetic nervous system. So here in your T12, L1, and L2, this will be the last one. It will be the last organs involved here. So T12, L1, and L2. And then it branches out towards two organs. We have your genitourinary. The effect is no urination. Let's just say negative urination, because urination is more onto your parasympathetic. This is your genitourinary, and the last one is reproductive organ. So reproductive organ, it's more on, I would like you to remember this one, the point and shoot. The point and shoot. For you to memorize or for you to remember, is this parasympathetic or sympathetic? So I should say point is erection and shoot is ejaculation. Of course, it needs to be pointed first before it ejaculates. Diba? That's why it's point, and shoot. Letter P stands for what? Parasympathetic. Letter S means sympa. In other words, ejaculation is sympathetic. So this is your sympathetic branch of your nervous system. So I'm gonna review from your T1 up to L2. This is where your nerves comes in and goes out to your paravertebral column or paravertebral ganglion, to be more specific, and it branches out its nerves towards the specific organs. For example, eyes, salivary glands, heart, lungs, stomach, pancreas, liver, GI in general, adrenal glands, in your colon, genitourinary, and reproductive organ. And these are the following effects. Heart, beta-1 receptors involved dito. It can cause increase in your heart rate, increase in your blood pressure. How about the lungs? It can cause bronchodilation. How about the stomach? Negative digestion, because the digestion is more onto your parasympathetic nervous system. How about the liver? It causes increase in your glucose. In other words, if you're stressed, your glucose is increased. Just like your adrenal glands as well, because it will stimulate the production of your cortisol. Cortisol is basically glucocorticoids. It will increase the production of your glucose by breaking down your glycogen complex form to form a glucose. And it also causes retention of your sodium and water. That will also eventually cause increase in your blood pressure. At the same time, that's only in your adrenal cortex. It will also stimulate your adrenal medulla to increase your norepinephrine and your epinephrine as well. In other words, it will also cause increase in your blood pressure because these chemicals can cause vasoconstriction. So if you look at sympathetic nervous system, it's almost like everything is going up except for the GI. Let's move on to your parasympathetic. Your parasympathetic, the involved nerves here are 3, 7, 9, 10. These are the cranial nerves. What are those cranial nerves? This is number 3, oculomotor. This is 7, facial nerve, the glossopharyngeal nerve, and your vagus nerve. We'll go into that in your cranial nerves. And then the sacral as well. In other words, it doesn't go through this paravertebral ganglion. It goes directly to your what? This group of cranial nerves. The nerves involved in your parasympathetic, for example, in your vagus nerve. It goes directly, not traveling from paravertebral through paravertebral. It goes directly to your, for example, to your GI. All the rest goes to here, 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 here. Diyan sila lahat. There's the nerves. The sacral area or the sacral nerves will give transmission of your nerve impulses to your genitourinary and your reproductive. But again, it doesn't travel through paravertebral. That's why it's called craniosacral. If you have thoracolumbar in your sympathetic, we also have your craniosacral system, which means to say it's parasympathetic nervous system. That's parasympathetic nervous system. So let's just make it opposite. Dry response, ang SNS and PNS, wet response, because it's usually like lacrimation, salivation, something like that. Since we talk about salivation, lacrimation, so here you can have in your eyes, the opposite of your negative lacrimation is basically lacrimation. Salivation. So what about in your heart? The effect is opposite, decrease heart rate and decrease in your blood pressure. What about in your lungs? In your lungs, it can cause decreased RR, bronchoconstriction, and hypoventilation. What about in your stomach? So basically digestion. How do you digest? By increasing your hydrochloric acid. In your pancreas, of course, increase in your pancreatic enzymes to digest protein, fats, and your carbohydrates. In your liver, decrease glucose by increasing your insulin. So it's the opposite, basically. In your adrenal glands, decrease norepinephrine, decrease epinephrine, so negative effect or a counter-regulatory mechanism by your adrenal medulla. What about in your cortisol? Decrease cortisol, the opposite, decrease in your glucose, basically, and low or less retention of your sodium and water that brings you to have low blood pressure. In your colon, you can have diarrhea. What about here? If you have negative urination on your genitourinary, you have urination. What about in your reproductive? Did I say point and shoot? It means to say point, letter P. Parasympathetic yan. It means to say it's erection. It's the opposite of your sympathetic nervous system. That's rest and repair. So there's certain mnemonic here. The simplest one is this. What's this? Salivation, lacrimation, and urination, and digestion. Make sense? Your slud. Feathering dumbbell. Letter S means salivation. Letter L means lacrimation. Letter U, urination, and digestion. These are just the basic mnemonics that we need to know, but there are so many more. If you look at the broad functions of your parasympathetic, this is applicable to your parasympa. This is parasympathetic nervous system. So another mnemonic, dumbbell. So double B tayo. This is digestion. Let's say drooling. That's your salivation. This is your urination. This is your meiosis. Oh, I forgot about this one. Lacrimation. You should add here, if you have lacrimation, you also have your meiosis, or also known as your constriction of your pupils. On the other hand, when you say sympathetic nervous system, this is also known as your mydriasis, or also known as dilation or pupillary dilation. In your eyes, it can cause no lacrimation, but it can cause dilation of your pupils or mydriasis. On the other hand, parasympathetic, it can cause meiosis and constriction as well, or constriction, or pupillary constriction, or pupillary meiosis. Parasympathetic can cause pupil constriction or pupillary meiosis. It should be bradycardia. This is bronchoconstriction. So this is emesis. And letter L stands for lacrimation. Anyway, digestion, drooling, urination, meiosis, bradycardia, bronchoconstriction, emesis, and lacrimation. If you think about it, it's actually not all, but it will help you. Okay, your slud and your dumbbell. Not the right spelling of your dumbbell, huh? So this is your sympathetic and parasympathetic nervous system.